terms of the coronavirus pandemic, parts of Netcare's Kingsway hospital in Amanzimtoti have been shut down. That's after several patients and staff tested positive for COVID-19. Mawande Kheswa is there for us. Let's find out what's happening there at the moment. Mawande, a very good morning to you. So what do we know about the shutdown of this hospital? We understand it's not the entire hospital, just parts of it.
Good morning. Well, at this point, there's very little information to go by. What we do know is, as you say, that parts of the hospital have been closed as a result of patients and staff being exposed to the coronavirus after testing positive. Now, there was a message that we had received from a resident in the Amanzimtoti area who said that they had brought their daughter here to receive some stitches and she was not allowed admission because the hospital had been closed as a result of what transpired as far as those COVID-19 positive cases are confirmed. Now, the patients and residents in the area were then instructed to use other hospitals such as Isipingo Medical Towers, which is not too far from here. So what we do know is that patients as well as staff have been exposed, and this has also been confirmed by Inehawu, who we will speak to during the course of the day. Now, Netcare has also responded through a statement that they just sent, and if you can just allow me to quote, they say that the COVID-19 in the hospital has been traced to a patient who was admitted via the emergency department on the 4th of April 2020 because of a stroke. Now, upon admission, there weren't any symptoms or signs of COVID-19. Now, during the hospitalization, the patient was visited by a general practitioner on the evening of the 7th of April, who then mentioned to the treating specialist that he had recently treated him for flu-like symptoms. Now, at this point, the specialist requested a COVID-19 test as a precautionary measure, even though the patient was still asymptomatic. At the same time, the patient was placed in an isolation ward under the investigation. Now, the test or the results of the patient came back on the 8th of April, confirming that the patient had the COVID-19 infection. So at this point in time, the hospital says that those are the origins of the first case, I would presume, in the hospital. This has now escalated to a point where other patients and staff have been infected, although we do not yet have the exact numbers.
All right, so but we know what we can confirm, though, is that it is patient and staff members as well. Then, Mawande, just give us some idea as to what you're seeing happening around the hospital this morning. Are there people who maybe have not received the message not to come to this hospital and are still trying to get in?
Well, not necessarily. It's not really busy. It's a quiet day, if I may say. There are some cars passing by. If I look to my left and look to my right, it's only media personnel that are here. There is no one else that is here. The security guard is at the gate, if I'm not mistaken. You do see vehicles going in and out, and those are of medical workers because some of them do have those surgical masks on as well as those gloves. So really, there isn't much of activity. Cars going in and out seem to be of medical personnel who presumably work inside the hospital. They're not having any trouble going in and out. I can see them taking out their access cards and being able to go in through the boom gates. So there isn't any activity whatsoever outside of our presence.
Now, we understand information limited at this point, Mawande, but do we know those staff members and patients who have tested positive, are they being kept in isolation at the hospital? Do we know anything about where they're being kept and under what conditions?
We do not yet know, but what I can tell you is that because this is a developing story, we will be able to flesh out those details as and when the information comes through, with dialogue with the unions who have been in contact directly with the staff members who are inside the hospital and those who work inside the hospital, to give us a clearer picture as to how many staff members are infected, along with the patients, and where exactly are they being kept.
All right, we'll leave it there for now. Thanks very much. Mawande Kheswa there outside Netcare's Kingsway Hospital in Amanzimtoti, where we know several staff members' patients testing positive for COVID-19.